Welcome to the Hydrafacial Keravive for Scalp Health learning experience. Hydrafacial Keravive for Scalp Health learning experience presents the theory of scalp health, marketing opportunity, and the Hydrafacial Keravive solution. The topics in this learning experience include Scalp Health 101, the importance for scalp health, Hydrafacial Keravive treatment, protocol, and regimen, before and after results, and client consultation. The objective of this learning experience is to provide you with information on scalp health, the scalp health industry, and how to leverage Hydrafacial Keravive in the scalp health market. By the end of this learning experience, you will be able to recognize the importance of scalp health, identify Hydrafacial Keravive product details, benefits, and features, recall Hydrafacial Keravive protocol and regimen, recognize the opportunity for combination therapies, and identify marketing opportunities and consumer needs. This information is designed to help you embrace this new and exciting category and establish a game plan to successfully leverage Hydrafacial Keravive in your business. This learning experience takes approximately 1 hour to complete. This learning experience contains audio. Make sure your volume is turned up. It is designed for a monitor display resolution of 1200 by 675. It runs in Google Chrome, Microsoft Edge, and Mozilla Firefox. And because we understand you may be learning on the go, this learning experience can be taken on any mobile device. To read along with the narration, access the Text tab on the top of the player window. The player controls, located at the bottom of the player window, allow you to play, pause, replay, and scroll through the slide content. Advance to the next or previous slide when available, and mute the audio when needed. Scalp Health 101. Hair has always played an important role in the history of humankind. In the modern Western world, cultures having full heads of hair are often associated with desirable qualities such as youth and vitality. Although hair and scalp health are of prime importance, the general public is not knowledgeable about scalp issues. Most people have little awareness about how to appropriately care for their scalp. A healthy scalp typically accompanies healthy hair. A healthy scalp gives the appearance of healthier hair, and vice versa. A healthy scalp is generally defined by a lack of disease or abnormalities, with normal follicular density, with no scaling, itching, burning, or erythema. Poor scalp health, however, is typically marked by scalp issues and hair loss. So, what is poor scalp health? Poor scalp health can be characterized by dry skin, clogged hair follicles, dead skin cells, and overall lack of circulation, all of which can lead to thinner-looking hair and inhibit the growth of healthy hair. Thinning hair and hair loss are confidence killers that affect over 100 million people in the U.S. alone. So basically, more than 30% of the population deals with thinning hair. Poor scalp hydration, clogged follicles, a buildup of dead skin cells, and poor circulation contribute to poor scalp health. Excess oil can also clog the hair follicle and allow fungi and bacteria to grow. I'm certain you're assessing your scalp right now and imagining what's going on there. According to Dr. Halaz, the benefits of a healthy scalp are critically important, yet not widely understood. Any patient who has concerns about thinning or damaged hair can benefit by improving the health of their scalp. A healthy scalp is the foundation for healthier and fuller-looking hair. At Hydrafacial, we decided to get to the root of thin, dull-looking hair, which is your scalp health. In this section, we're going to review hair anatomy, the characteristics of human hair, how hair grows, scalp conditions that lead to hair loss, reasons for hair loss in women and men, current hair loss and scalp health treatments. The more you know about the structure of the hair and how to keep the scalp healthy, the more you will understand how the Hydrafacial Keravive treatment affects scalp health. Let's start this section with learning about the structure of the hair. A mature strand of human hair is divided into two parts, the hair root and the hair shaft. The hair root is the part of the hair located below the surface of the epidermis, outer layer of the skin. The hair shaft is the portion of the hair that projects above the epidermis. The 5 main structures of the hair root include the hair follicle, hair bulb, dermal papilla, arrector pili muscle, and sebaceous oil glands. The hair follicle is the tube-like depression or pocket in the skin or scalp that contains the hair root. Hair follicles are distributed all over the body with the exception of the palms of the hands and the soles of the feet. The follicle extends downward from the epidermis into the dermis, the inner layer of skin, where it surrounds the dermal papilla. Sometimes more than one hair will grow from a single follicle. The hair bulb is the lowest part of a hair strand. It is the thickened, club-shaped structure that forms the lower part of the hair root. The lower part of the hair bulb fits over and covers the dermal papilla. The dermal papilla is a small, cone-shaped elevation located at the base of the hair follicle that fits into the hair bulb. The dermal papilla contains the blood and nerve supply that provides the nutrients needed for hair growth. Some people refer to the dermal papilla as the mother of the hair because it contains the blood and nerve supply that provides the nutrients needed for hair growth. The arrector pili muscle is the small, involuntary muscle in the base of the hair follicle. Strong emotions or a cold sensation cause it to contract, which makes the hair stand up straight and results in what we call goosebumps. Sebaceous glands are the oil glands in the skin that are connected to the hair follicles. The sebaceous glands secrete a fatty or an oily substance called sebum. Sebum lubricates the skin. So what is keratin? Hair is formed by cells in the germinal matrix, which is the growth zone. Each cell goes through mitosis or cell division, moves upward through the hair follicle, matures, loses the nucleus and organelles, and dies in a process called keratinization. As these newly formed cells mature, they fill up with a fibrous protein called keratin. By the time the hair shaft emerges from the scalp, the cells of the hair are completely keratinized and are no longer living. The hair shaft that emerges is a non-living fiber composed of keratinized protein. The 2 main types of hair found on the body are vellus hair and terminal hair. Vellus hair, also known as lanugo hair, is short, fine, unpigmented, and downy hair that appears on the body. It is commonly found on infants and can be present on children until puberty. On adults, vellus hair is usually found in places that are normally considered hairless, like the forehead, eyelids, and bald scalp, as well as nearly all other areas of the body except the palms of the hands and the soles of the feet. Women normally retain 55% more vellus hair than men. Vellus hair helps with the evaporation of perspiration. Terminal hair is the long, coarse, pigmented hair found on the scalp, legs, arms, and bodies of males and females. Terminal hair is coarser than vellus hair, and with the exception of gray hair, it is pigmented. The average hair density is about 2,200 hairs per 1 square inch. Hair with high density, thick or dense hair, has more hairs per 1 square inch, and hair with low density, thin hair, has fewer hairs per 1 square inch. The average head of hair contains about 100,000 individual hair strands. The number of hairs on the head generally varies with the color of the hair. Blondes usually have the highest density, and people with red hair tend to have the lowest. Hair growth occurs in cycles. Each complete cycle has 3 phases that are repeated throughout life. The 3 phases are anagen, catagen, and telogen. Now, let's hear a physician discuss the hair growth cycle.
Welcome to Hillside Hair Clinic educational video. The information you're about to see applies equally to both men as well as women. You can see that the hair, skin, and blood vessels form quite a complex structure. This is called the hair follicle. For some who may not know, hair has its own natural cycle. It grows from the dermal papilla, which is the oval stem cells. It passes through 3 phases and it dies. Once this hair dies, another starts growing. The first phase, called the anagen phase, is actually the growing phase of the hair. While it starts growing, it pushes the old hair out. The phase continues for up to 6 years. After this, the growth of the hair slows down and changes from late anagen to the catagen phase. This catagen phase is the involuting, regressing, or dying phase. It lasts up to 6 weeks. Growth stops and the hair follicle detaches from the dermal papilla stem cells and falls. This process cuts the hair off from its blood supply and from the cells that produce new hair. After the second phase, the hair follicle enters the telogen phase, which is a resting phase of the hair follicle, lasting around 6 months. When the body is subjected to extreme stress, as much as 70% of hair can prematurely enter the telogen phase and begin to fall, causing a noticeable loss of hair. Or being no longer attached, it can appear dull. The hair cycle is controlled in every step by signals from the scalp and from the body. Some signals, the blue ones, tell the dermal papilla cells to start producing hair and grow. These signals are the growth factors, which last up to the anagen phase, telling the hair to grow. On the other hand, some other signals, the black ones, tell the hair to die and fall out. These signals tell the hair to enter the catagen phase, and it dies. This process may continue in exactly the same way for some people during their entire life. The cycle of the hair passes a 6-year anagen phase before entering for a few months in the catagen and telogen phase, where the hair falls out. There is a possibility, though, for others, while going through life changes, the cycle shortens and the hair becomes thinner. Under these circumstances, the hair goes through all 3 phases as normal, but the anagen phase becomes shorter each time. As a result, the hair starts growing slower and not as long. This process is called miniaturization, where each cycle gets weaker, shorter, and less colored until the hair can barely be seen. Although the hair follicle is not dead, it can hardly produce any hair as time passes. The big question here is, how do we maintain anagen? The only way to stop the process of miniaturization is to figure out how much time the hair spends in the anagen phase. If we succeed this, the hair will grow in a natural, healthy way by staying longer in this growing phase of the cycle. Prolongation of the anagen phase is increased by PRP, platelet-rich plasma, as this has growth factors which are more concentrated than ordinary plasma. PRP not only stimulates dormant hair follicles and stem cells, but encourages collagen production, which is responsible for thickening of the hair. It has been shown that if PRP is used during a transplant procedure, better results of hair growth are seen in a shorter period of time. The blue particles represent the growth factors, which are increased 5 to 6-fold in the PRP. It is these increased growth factors which are responsible for the thickened, healthy hair growth in both men and women without any side effects. For more information, please contact us today here at Hillside Hair Clinic.
Scalp conditions that may contribute to hair loss are androgenic alopecia, alopecia areata, telogen effluvium, anagen effluvium, and traction alopecia. Click on each tab to learn more about each condition. Androgenic alopecia, also known as androgenetic alopecia, is hair loss that's characterized by miniaturization of terminal hair, which is converted into vellus hair. It is usually the result of genetics, age, or hormonal changes that cause terminal hair to miniaturize. Androgenic alopecia typically occurs gradually and in predictable patterns. This condition can appear as early as the teens, but most frequently appears by the age of 40. By age 35, nearly 40% of both men and women show some degree of hair loss. Humans shed approximately 50 to 100 hairs a day from the scalp during the hair growing cycle. Hair regrows automatically so that the total number of hairs on our head remains constant. Telogen effluvium occurs when there is a marked increase in the number of hairs shed each day and an increased proportion of hair shift from the growing phase, anagen, to the shedding phase, telogen. Normally, only 10% of scalp hair is in the telogen phase, but with telogen effluvium, this increases to 30% or more. This usually happens suddenly, or it can occur approximately 3 months after a trigger, such as childbirth, severe trauma or illness, a stressful or major life event, extreme weight loss, and extreme dieting, a severe skin problem affecting the scalp, a new medication, or withdrawal of a hormone treatment. No cause is found in around a third of people diagnosed with telogen effluvium. Telogen effluvium is not inherited, and it can affect all age groups and both genders equally. Alopecia areata is a common autoimmune skin disease causing hair loss on the scalp, face, and sometimes on other areas of the body. In fact, it affects as many as 6.8 million people in the U.S. with a lifetime risk of 2.1%. People of all ages, both sexes, and all ethnic groups can develop alopecia areata. It often first appears during childhood and can be very different for everyone who has it. Anagen effluvium is a significant loss of hair shafts in their anagen phase. The onset may be rapid and can occur within 2 to 4 weeks of the cause. Major hair loss may result in extreme cases. Hair usually returns spontaneously. Possible causes of anagen effluvium are chemotherapy drugs, antimitotic agents, radiotherapy, malnutrition, seborrheic dermatitis and other localized dermatoses, oral contraceptives, vitamin A poisoning, iron deficiency, chronic infections, drug abuse. Traction alopecia is a form of hair loss in which mechanical damage to the hair follicle is caused by repeated tension or pulling. This type of hair loss is common among people with skin of color, especially African American and Black women, ballerinas, gymnasts, military personnel, and specific professionals who are required to wear their hair pulled back. Traction alopecia can be caused by wearing the same hairstyle for long periods of time, especially styles that tug on the hair. For example, braids, weaves, cornrows, tight ponytails, heavy locks, hair rollers, and so forth. Chemical hair relaxers and perms can lead to even further damage. The constant pulling on the hair causes loosening of the hair from the follicles, especially around the edges. Symptoms associated to traction alopecia include bumps, redness, and tenderness on the affected area. The prolonged inflammation and repeated hair tension may lead to gradual hair loss and scarring of the hair follicles. For males, the androgen receptor gene creates the receptor on hair follicles that interacts with testosterone and dihydrotestosterone, DHT. And if your receptors are sensitive, hair loss can occur. The body produces DHT as a byproduct of testosterone through the 5A reductase enzyme, which is an enzyme that converts a certain percentage of your testosterone into DHT in tissue such as the skin, liver, prostate, and hair follicles. DHT can bind to hair follicle receptors and cause them to shrink, weaken, and eventually die for those genetically susceptible to hair loss. Remember, this process is called miniaturization, and it eventually leads to a complete end of hair growth in DHT-affected hair follicles. The Ludwig scale is a method of classifying female pattern baldness on a scale ranging from stages 1 to 3. Stage 1 begins with thinning on the top of the head. During stage 2, the scalp starts to show. In stage 3, all the hair at the crown of the head may be lost. The Hamilton-Norwood scale is the leading classification system for male pattern baldness, another name for androgenic alopecia. Since men typically lose their hair in one of several common patterns over the course of many decades, the Hamilton-Norwood scale provides easy-to-reference images that indicate different stages of balding, ranging from 1 to 7, and is commonly used by clinicians to diagnose the extent of baldness, discuss treatment options, and measure the effectiveness of treatment. Androgenic alopecia in men typically resembles the shape of a horseshoe, as the back and sides of the head are typically more resistant to DHT. Let's look at current treatments on the market for hair loss and scalp health. Currently, there are a variety of treatment options for those experiencing thinning hair or hair loss, ranging from topical solutions such as minoxidil, or what you might know as Rogaine, oral remedies like finasteride, biotin, and herbal supplements, to at-home devices such as LED helmets, headbands, caps, and combs. There are also a variety of in-office treatments and procedures available, including hair transplants, low-level light therapy, stem cell conditioned media, and microneedling. New approaches to treating hair loss are platelet-rich plasma (PRP) and synthetic growth factors and proteins treatments. PRP is a concentrate of platelet-rich plasma protein derived from whole blood. PRP is used as a treatment by doctors to accelerate healing in various areas of the scalp when hair loss is a result of androgenic alopecia. PRP contains a range of growth factors and proteins that speed tissue repair, which may help restore hair growth. During this procedure, medical professionals take a blood sample, spin it through a centrifuge, and extract platelet-rich plasma to inject back into a patient's scalp. The pros to PRP are: PRP treatment is a simple procedure that does not involve any surgery or incisions, short recovery period, natural-looking end result. It promotes faster natural hair follicle stimulation that can help in hair growth. PRP can be used to promote hair growth in areas where laser and other technologies cannot be used. The cons to PRP are time-consuming, painful injections. Results may vary from person to person. Results may be attributed to other factors. Cost prohibitive. And extracted PRP is only as good as the health of each patient. Growth factors are ligands that play important roles in the body and are responsible for tissue regeneration, wound healing, and the maintenance and growth of cells, including hair. Synthetic growth factors are lab-engineered to behave like natural human growth factors. Practitioners are looking at ways to use these biomimetic growth factors to use therapeutically for people with various hair and scalp issues. The Hydrafacial Keravive peptide complex is comprised of synthetic growth factors. Introduction to Hydrafacial Keravive. Hydrafacial Keravive is the solution for scalp health issues. Hydrafacial Keravive is a unique, relaxing treatment designed to cleanse, exfoliate, nourish, and hydrate the scalp for healthier and fuller-looking hair. Hydrafacial Keravive uses existing Hydrafacial Elite, Tower, and Allegro machines, along with a proprietary peptide complex solution designed to optimize scalp health during a 3-step, 30-minute treatment that is painless and has no downtime. Here are the steps. Step 1. Cleanse and exfoliate. Hydrafacial vortex technology is used to extract dirt, oil, and impurities from the scalp and hair follicles while priming the scalp for Step 2. Step 2. Hydrate and nourish. Hydrafacial Keravive peptide complex solution is used to nourish and hydrate the scalp and hair follicles with biomimetic growth factors for healthier and fuller-looking hair. Step 3. Extend and enhance. Hydrafacial Keravive peptide complex spray is used daily to enhance in-office treatments and delivers daily nourishment to the scalp and hair follicles. The combination of in-office cleansing, exfoliation, and hydration, and the daily use of the take-home spray improves hydration and nourishes the hair follicles for thicker, shinier, healthier-looking hair. Hydrafacial Keravive improves scalp health, provides an additional revenue opportunity in a rapidly growing market, and does so with no additional capital investment. The importance of scalp health. Hydrafacial Keravive is for everyone. Most hair remediation therapies aren't suited for all degrees of hair loss. But Hydrafacial Keravive is a fantastic option for people with a full head of hair, as well as people who are struggling with full baldness. The skin on our scalp is an extension of the skin on our face. So everything your clients love about Hydrafacial for the face, they will love about Hydrafacial for the scalp, and with no additional capital purchase. So what is the market opportunity for Hydrafacial Keravive? The hair loss industry has grown to over $3.9 billion globally, with treatments administered by doctors and medi-spas, the fastest growing segment, increasing by more than 31% since 2014. While we are not addressing hair loss or making hair regrowth claims, the hair loss industry and the consumers it attracts are among the target population for Hydrafacial Keravive. Consumers seeking solutions, whether it's with oral, topical, or laser treatments or procedures, are a highly motivated and emotional audience who is willing to put time, money, and effort into hair remediation. Think of this $3.9 billion opportunity as just the tipping point. This only accounts for consumers dealing with hair loss. It does not consider consumers who are dealing with general scalp dryness, dandruff, itching, and flaking, or those seeking preventative or maintenance care. And as Dr. Halas put it, the benefits of a healthy scalp are critically important, yet not widely understood. Any patient who has concerns about thinning or damaged hair can benefit by improving the health of their scalp. A healthy scalp is the foundation for healthier and fuller-looking hair. Now let's talk about the actual needs of consumers. Those 100 million plus Americans referenced earlier struggling with thinning hair. Because hair is important to self-image and self-esteem, consumers struggling with hair loss and thinning are ideal targets for Hydrafacial Keravive, as they are emotionally invested and tend to be willing to try multiple treatments or methods in pursuit of solutions. This is an audience that can greatly benefit from the Hydrafacial Keravive treatment to improve their scalp health. Remember, a healthy scalp is the foundation for healthier, fuller-looking hair. Consumers struggling with damaged or thinning hair are just the tipping point. Just like Hydrafacial is for everyone, Hydrafacial Keravive is a treatment that everyone can benefit from, regardless of scalp health, skin type, or gender. We've heard a lot of providers positioning Hydrafacial as a starting point for all skin care and skin correction regimens. Come in and start with a Hydrafacial. We'll assess your skin health goals and devise a suitable regimen. Hydrafacial Keravive is no different. It is the starting point or foundation for all scalp and hair care regimens. The topic of scalp health is becoming less of a taboo issue, similar to everyone talking about where they go for Botox. Many mainstream publications are addressing scalp health. Click each tab to learn more about what each magazine wrote about scalp health and Hydrafacial Keravive. Let's take a closer look at what Glamour had to say about it. Everyone, no matter their gender or age, can benefit from taking care of their scalp, says Dr. Ariel Osted, a New York-based dermatologist. Your scalp is more prone to dryness than your hair, and a buildup of styling products and increased pollution can lead to irritation and flakiness. Hadley King, MD, a dermatologist at Skinny Med Spa in New York City, adds that excess dryness is something to keep your eye on, as it can eventually lead to hair loss. Into the Gloss had the cutest nod to scalp treatments. Call it a scalp massage or a scalp treatment if you're feeling fancy. It's essentially a facial for your head. After all, the skin on your head is only an extension of the skin on your face. Use a scalp massage to cleanse, hydrate, invigorate, or remove dead skin, says Lisa Caddy, a trichologist. Using a scalp treatment targeted for your needs or concerns can be a great problem solver and a good way to optimize hair growth. While New Beauty gave us an awesome shout-out noting, Hydrafacial is another traditionally skincare-focused brand that's taking on the scalp care revolution with its new Hydrafacial Keravive. Hydrafacial Keravive was also recently mentioned in Shape magazine. Shape reported that you can also clear clogged follicles and promote growth with a professional treatment like the Hydrafacial Keravive, which extracts impurities and infuses the scalp with growth factors and proteins. Hydrafacial Keravive treatment, protocol, and regimen. Hydrafacial Keravive is a 3-step, 30-minute treatment that is painless and has no downtime. Hydrafacial Keravive uses your existing Hydrafacial Elite, Tower, and Allegro machines and is designed to restore scalp health. Hydrafacial Keravive is a unique, relaxing treatment designed to cleanse, exfoliate, nourish, and hydrate your scalp for fuller and healthier-looking hair. Click on each tab to learn a bit more about the features and benefits of Hydrafacial Keravive and the Hydrafacial Keravive difference. Hydrafacial Keravive uses the machine and solutions you already have and only requires purchase of the Hydrafacial Keravive Complete Kit, which includes 2 Keravive Peptide Complex Solution vials, 1 yellow Keravive tip, and a 30-day take-home Keravive Peptide Complex spray for your client. Hydrafacial Keravive is another way you can meet consumers' increasing desire for personalized services and treatments. Introduce a new treatment and revenue potential for your practice without additional equipment or capital investment. And offer a treatment very appealing to men, as poor scalp health and thinning hair typically affects more men than women. This also creates opportunity to discuss your entire Hydrafacial menu with them. Hydrafacial Keravive is a value-added opportunity for you, with no additional equipment or attachments needed. What makes Hydrafacial Keravive unique is the concentration and nanoliposomal delivery technology, with ingredients up to 200 times more concentrated than other types of scalp health treatments. Hydrafacial Keravive targets every aspect of scalp and follicle health. Ingredients are also encased in nanoliposomes, which are small enough to penetrate tiny hair follicles for optimal absorption. Because the skin on our scalp is an extension of the skin on our face, we wanted Hydrafacial Keravive to be an extension of the Hydrafacial treatment. It was important to us that we stayed true to the Hydrafacial brand, being that it is painless and has no downtime. Let's take a closer look at the standard scalp health protocol. Step 1. Cleanse and exfoliate to prime the scalp for Step 2. Step 2. Hydrate and nourish with biomimetic growth factors to promote thicker, healthier-looking hair. Step 3. Extend the Hydrafacial Keravive treatment with daily use of the take-home solution to enhance Hydrafacial Keravive or oral, topical, laser, and surgical hair loss treatment results. Where Hydrafacial Keravive deviates slightly from our traditional Hydrafacial offering is the first 2 steps are performed in office, while the third is focused on at-home care. So you can really market this as a 30-day treatment. Another important distinction is that Hydrafacial Keravive is delivered as a series of 3 treatments. Hydrafacial Keravive is a 3-month treatment regimen delivered in-office once a month and daily use of the take-home spray in between office visits. This regimen ensures optimal results for every patient. The recommended regimen for Hydrafacial Keravive is as follows. In-office treatment once per month for 3 consecutive months. Daily use of the take-home Hydrafacial Keravive peptide complex spray. After the initial 3 months, clients can choose a maintenance plan, continuous monthly in-office treatments, or continuous use of take-home spray, and to maintain results, it's recommended that clients receive a Hydrafacial Keravive treatment every 6 months. Before and after. Now, let's take a look at some before and afters. Who would disagree that the proof is in the gunky? As you know, there is tremendous power in the gunkies. Click on each tab to see the differences of face and scalp gunkies. The left vial contains gunkies from the Hydrafacial treatment. The right vial contains Hydrafacial Keravive gunkies. That looks a lot like scalp gunkies. Here is a side view of face and scalp gunkies. As you can see, there is quite a bit of debris in the scalp canister. This buildup of debris clogs hair follicles and causes poor scalp health. The scalp should be exfoliated just like the skin on the face to remove impurities. Exfoliating the scalp removes that buildup, so the follicles are prepared to receive the nutrients in the Hydrafacial Keravive peptide complex. Here is the bottom view of the same gunkies. This view clearly shows that addressing scalp health is a necessity. Here is a live video of a post-Hydrafacial Keravive gunky. Now let's take a look at some before and after photos. Click on each tab to see before and after Hydrafacial Keravive treatment pictures. This is a close-up of the hair follicle before and after Hydrafacial Keravive. You can see microscopic debris is removed here. We have several customers who are already offering Hydrafacial Keravive. This is a before and after from one of their treatments. This client's hair is visibly healthier and fuller looking. These results are after 1 treatment and 30 days of using the take-home spray. One more fantastic before and after of 1 treatment and 30 days of the take-home spray. Healthier and fuller looking hair here too. Click each tab to see before and after results that include images of treatment results 1 month after the first application and after the 3rd application. In these photos, you can see improved appearance of fuller hair around the hairline. Her hair also appears fuller at the top and towards the crown. This client clearly has fuller-looking hair around his hairline after his 3rd treatment. His crown also appears fuller and thicker. Client consultation. Dr. Eva Shamban, a world-renowned dermatologist, published author, and key opinion leader, recently hosted an exclusive media event in Paris, France, that included our Chief Executive Officer, Clint Carnell. Here, the day was spent discussing the potential for Hydrafacial Keravive in the scalp health market. Dr. Shamban has been an advocate for Hydrafacial Keravive from the start, as she's experienced positive results with the treatment. Dr. Eva Shamban shares that the natural hair aging process may be a culprit as hair follicles decrease in production and can even shrink between the ages of 20 and 25. Dr. Shamban notes that the celebrity-beloved Hydrafacial launched a new scalp treatment in January, Hydrafacial Keravive, with verified results in hair texture, strand thickness, and color. Keravive is described as a treatment that consists of 3 non-invasive in-office treatments with the device and includes a scalp serum with peptides and biomimetic growth factors. Dr. Shamban explains that combining treatments like Keravive along with injections of platelet-rich plasma, PRP, can help improve microcirculation and stimulate the hair follicles optimally for visible results. As with the traditional Hydrafacial treatments, Hydrafacial Keravive is an "and" treatment, so this will not interfere with other scalp and hair treatments offered by scalp care providers. Now, on to the Hydrafacial Keravive treatment. And as mentioned, Hydrafacial Keravive is aligned with Hydrafacial treatments you already know and love. Hydrafacial's position has never been and will never be about choosing Hydrafacial over other skin and scalp health products, treatments, and procedures. What makes Hydrafacial unique is that with skin and scalp, we are an "and" company. Just as Hydrafacial complements skin care and skin correction regimens, Hydrafacial Keravive serves as a complementary offering to hair care and hair remediation treatments and procedures. Here you can see how Hydrafacial Keravive perfectly complements all hair care and hair remediation regimens, putting the product in a category of its own. On the right, you have higher frequency hair care options that include topicals, supplements, and devices. On the left are non-invasive and invasive hair loss remediation options that include non-invasive procedures and invasive medical procedures. The Scalp Health Continuum shows how the middle, Keravive, elevates and extends the other items' hair care and hair loss remediation treatments. Thus, Hydrafacial Keravive is the bridge between these segments. Hydrafacial Keravive defines the scalp health category as the foundation for healthier, fuller-looking hair, and complements and enhances daily hair care regimens and hair loss remediation methods. Hydrafacial Keravive complements and enhances oral and topical hair loss and surgical treatments by creating a healthier, exfoliated, and nourished scalp. Similar to how Hydrafacial improves overall skin health to enhance and improve other aesthetic treatments. Within our pilot markets, we learned it not only complemented other scalp health treatments, it provided an additional revenue opportunity for those not yet addressing scalp health. It's a win-win for everyone. Let's hear what practitioner Rachel Lowe has to say about complementary treatments.
One of the things I'd love to start with is you guys were actually part of the Hydrafacial Keravive pilot. Is that correct?
Yes.
So you were really the first ones to kind of play around with it. You've had a lot of time to experiment and explore, like you said, using it as a standalone treatment and also as a complementary treatment. So one of the questions we received was, what do you think has made the treatment successful in your practice? Was it combining it with things, the way you promoted it, and what were some of your key takeaways in launching that product?
Well, since we already do some hair treatments that we offer are PRP injections, hair follicle transplants, and so this was really a nice thing to kind of, at first we tried to introduce it as a standalone, which did help some people that didn't want to go on a more serious route of hair transplants. But what I found was, even though it does help for hair growth, it really is good for scalp health. And you may not think that's a big deal, but when you have a Keravive treatment and you show the gunky afterwards, it's quite more gunky than the regular face, and it's very self-gratifying. And if we're going to be injecting some exosomes or PRP where we're piercing the scalp with a needle, how much better is that treatment going to be if we completely cleansed and exfoliated the skin on the scalp, so that when we're doing our needle sticks and we're injecting certain types of materials into the tissue, we have like a clean palette canvas, so to say. Also, it helps the needle go into the skin and it's more comfortable. So it's not that we're using a numbing product, but think about it. We're softening the tissue with those ingredients from the beta HD. So as the needle penetrates into the tissue, they're not cringing, they're not squinting as much. It really makes the treatment more comfortable on top of making the scalp healthy. Then about 24 hours after they've had their PRP or exosome injection, we're going ahead and having them use the at-home growth factors and proteins that go onto the scalp. So we're using it as a maintenance and support to what we're doing in the office. So those two treatments together, as we combine the home care, the 3 Hydrafacials once monthly with the 3 PRPs on the same day as our Hydrafacial, we've been seeing some very good results.
And what does this opportunity look like for you? For ease of administering the treatments, Hydrafacial Keravive comes in a complete kit. This includes 2 vials, 1 yellow tip for step 2, and 1 30-day take-home spray for the client. You can also purchase the take-home spray separately as to provide a topical treatment option. The revenue opportunity is achieved when you price Hydrafacial Keravive at $600. It increases when you price treatments at $700. Our most successful providers are charging a premium for single treatments by pricing 3 treatments at $1,500. What a great way to reward clients for investing in their scalp health. There are many options for hair and scalp therapies, from larger in-office remediation like PRP and hair transplants, to at-home treatments like daily use shampoos and conditioners and scalp massagers. Keravive sits right in the middle of this spectrum, offering both a 30-minute in-office treatment and a 30-day supply of take-home spray to extend the benefits of the treatment between in-office visits. This makes Keravive the comprehensive scalp health solution. The Hydrafacial Keravive talk track provider to clients is a great tool that supports your client consultation. Client consultations are important for determining the client's needs and how to achieve the desired results. The talk track is a template for you to use to assess the client's hair and scalp care habits and educate the client on the Hydrafacial Keravive treatment and treatment pricing. Download or print out the talk tracks so you will have it for your quick reference. Let's take a look at the Hydrafacial Keravive protocol video, which highlights everything from the client consultation to the actual treatment. This video is available to you on Hydrafacial Connect. In this video, we will discuss how to deliver a Hydrafacial Keravive scalp treatment. For best results, it's recommended that clients have this treatment once a month for 3 consecutive months. The Hydrafacial Keravive treatment cleanses and exfoliates the scalp, extracts debris and impurities, stimulates circulation, and nourishes the scalp and hair follicles with the Keravive Peptide Complex solution, a proprietary blend of growth factors and skin proteins that help promote fuller, thicker, and healthier-looking hair. The complete Hydrafacial Keravive treatment includes an in-office treatment done using the Hydrafacial Elite, Tower, or Allegro devices, as well as a take-home spray that the client uses at home in between in-office treatments. First, discuss the client's areas of concern with their scalp health and hair to determine where to focus the treatment. Step 1 of the in-office treatment uses the Hydrafacial Vortex technology, Beta HD Clear solution, and a Hydrapeel blue tip to cleanse and exfoliate the scalp. Step 2 of the in-office treatment stimulates and nourishes the scalp with the Hydrafacial Keravive Peptide Complex solution. Upon completion of the in-office treatment, the client takes home a bottle of Keravive Peptide Complex spray to be used once a day in between treatments. Let's review the process and products for each step. Preparation. Advise the client to avoid using styling products before the treatment and to come in with clean, dry hair. Before the client arrives, prepare the treatment room. In addition to Beta HD Clear solution and the Hydrapeel blue tip, the treatment uses 2 9-milliliter vials of the Keravive Peptide Complex solution, the yellow Hydrafacial Keravive tip, and a 100 milliliter bottle of the Keravive Peptide Complex spray. Place a single-use Hydrapeel blue tip on the tool holder, as well as the single-use Hydrafacial Keravive yellow tip that is unique to the scalp treatment. You will need gloves. A comb with a tail to part the hair and hair clips to hold the hair back may also be useful depending on the thickness of the client's hair. The consultation. Place the client at a comfortable incline with a small rolled towel or pillow beneath their neck. Ask them if they have specific areas of concern with their scalp and hair health. For example, Are they experiencing a dry, itchy, irritated scalp? If so, where? Are they concerned about excessive buildup from styling products? If so, where? Do they have specific areas of visibly thinning hair that they are concerned with, such as the crown, a receding hairline at the forehead, or a receding hairline at their temples? For example, men generally experience exposed scalp and thinning hair around the crown, temples, or a receding hairline. Women may experience the same concerns as men, or may be experiencing patchy circles or hair that is thinning evenly overall. Step 1. Cleanse and exfoliate. Position the client looking straight ahead to treat central areas. Have the subject look to the right or left to treat temporal areas. Beta HD Clear Solution and a Hydrafacial blue tip is used for the scalp cleansing and exfoliation step. Remove the reusable cleaning cap from the handpiece and replace it with a single-use Hydrafacial blue tip designed for exfoliation. The long end of the tip should be aligned with the top of the handpiece. Use the system touchscreen to start the vacuum. Set vacuum to 25 and set the handpiece serum flow valve to approximately a 20 to 30% serum flow. Adjust vacuum down as necessary for client scalp sensitivity. Before applying, occlude the handpiece, bringing the solution to the tip, and adjust the flow if needed. Part the client's hair with the tail of a comb or your fingers in small sections in order to expose the scalp area. Starting at the hairline and moving back towards the crown, perform short strokes, making contact with the scalp to identified scalp area. Alternatively, you can start at the crown and move forward towards the hairline. Choose the direction that gives you the best contact with and occlusion on the scalp. Stimulate the area until the scalp turns a healthy pink. Choose the next area either to the left or right of the treated area. Part the hair again to expose skin. Remember to work in small sections in order to exfoliate as much of the scalp as possible. Repeat until the entire identified working area is covered. Remember, it is important to target the strokes along the scalp so as not to inadvertently cause damage to hair. When you have exfoliated target areas, turn off toggle for Beta HD Clear Solution, discard Hydrafacial blue tip, and complete a 10 to 15 second system rinse to flush out the handpiece. Step 2. Stimulate and nourish. 2 9-milliliter vials of the Hydrafacial Keravive peptide complex solution are used in this step of the in-office treatment, along with the yellow Hydrafacial Keravive tip. Remove cartridge from the handpiece and insert the first vial of the Hydrafacial Keravive peptide complex solution into the handpiece. Switch to the Hydrafacial Keravive yellow tip and adjust the vacuum setting down to 21. Focus the application of the solution on the problem areas identified in the consultation. Repeat the same pattern followed during the exfoliation process. Part client's hair with the tail of a comb or your fingers in small sections in order to fuse the solution into as much of the scalp as possible. Starting at the hairline and moving back towards the crown, perform a back and forth twisting motion along the length of the exposed scalp, working along the parted hairline in a tight grid pattern. Alternatively, you can start at the crown and move forward towards the hairline. Choose the next area either to the left or right of the treated area. Part the hair again to expose skin. Remember to work in small sections in order to deliver the Hydrafacial Keravive peptide complex solution to as much of the scalp areas of concern as possible. Repeat until the entire identified working area is covered. Use the second 9-milliliter vial of the Hydrafacial Keravive solution to ensure full coverage of the targeted areas and expand to additional sections of the scalp where possible. After completion of the second vial, perform a 5-minute scalp massage to help the Hydrafacial Keravive solution penetrate the entire targeted treatment area. Remove the Hydrafacial Keravive vial from the handpiece, replace the cartridge into the handpiece, and discard the Hydrafacial Keravive yellow tip. Advise client to allow scalp and hair to fully dry before applying heat or styling products. Finish by showing the client their gunky to demonstrate the amount of dirt and debris removed from the scalp. Step 3. Extend and enhance. Following the in-office treatment, present the client with their 30-day take-home Hydrafacial Keravive Peptide Complex Spray. Educate the client on how to manually apply the Hydrafacial Keravive Peptide Complex Spray at home daily, beginning the day following their in-office treatment. The client should leave with their Hydrafacial Keravive spray and an appointment for their next treatment in 30 days. Home use spray instructions. Apply 1 to 2 sprays per area of concern once a day, placing nozzle directly on scalp while spraying. After spraying, massage solution into scalp for 30 to 60 seconds. For best results, apply in the evening and allow solution to remain on the scalp overnight. Thank you for partnering with us at Hydrafacial. We look forward to supporting your ongoing success. Testimonial. Let's hear what Sarah Wu, a beauty writer in Berlin, had to say about Hydrafacial Keravive in a Glamour article published on July 15, 2020. The feeling is incomparable. I cannot even tell you the last time my hair and scalp felt so clean and refreshed. I would liken the sensation to spending a week at a spa resort if the resort's facilities were entirely dedicated to my scalp. Honestly, I was having trouble processing the first-time feeling, but I can tell you that no salon shampoo or head massage has even come remotely close. At home, I continue to use the spray twice a day, making sure to spend a few minutes massaging it in, a habit I recommend you do whether or not you try this treatment, as it does stimulate circulation. The spray's actives help to regulate cellular turnover and soothe inflammation, so that I saw long-lasting results from my scalp treatment session. My scalp breakouts have cleared, my hair no longer feels like it has a layer of gunk in it, and that mild itching is a thing of the past. I rarely recommend treatments with results that you can feel more than see, but for the relief I got out of that single session, I'm already saving up for the next one. Conclusion. Now that you have reviewed this information on the importance of scalp health, the features and benefits of Hydrafacial Keravive, how to incorporate in your practice, and the rapidly growing scalp health market, you'll be able to speak confidently to your customers, knowing that Hydrafacial Keravive is the perfect solution to multiple scalp health concerns and the answer to promoting healthier-looking hair. I hope this course on scalp health and the Hydrafacial Keravive treatment helps you understand how to successfully incorporate scalp health and Hydrafacial Keravive into your business. Your homework is to watch the Hydrafacial Keravive protocol video on Hydrafacial Connect. Visit the resources section and download all supporting documents to familiarize yourself with them. You are also invited to join us at one of our state-of-the-art experience centers for our Sprout program, which is dedicated to Hydrafacial Keravive. Review the training and education schedule on Hydrafacial Connect for upcoming dates. Be sure to incorporate scalp health questions into your consultation process to stimulate conversation surrounding the tremendous opportunity with Hydrafacial Keravive. Remember to tag Hydrafacial in your Hydrafacial Keravive before and after pics. We can't wait to see how you celebrate the scalp in your business. Thank you.